Hello, future RT. Zach Willis here, coming from my old bedroom. Today I'm here to tell you about secretion clearance techniques and exercises. Of course, we know that the patients that benefit most from the secretion clearance exercises are cystic fibrosis patients, your bronchiectasis patients, the ones with chronic bronchitis, and those who have pneumonia. These, of course, are people who benefit most from secretion and clearance because that's a problem for them. Now, I know I'm supposed to talk about devices or not, especially the devices are just like techniques or exercises, but I'm going to briefly go over some of the devices that are used for help for like expelling mucus or bringing up mucus, from particularly the lower lobes up into the larger airways and out. Now, there is the PEP devices, specifically the oscillating PEP devices, positive expiratory pressure devices such as the acapella, such as the flutter valve, such as the arabica. These help mobilize secretions. The oscillating vibrations help shake free mucus plugs by increasing pressure in the airways. And this enables air to get behind those secretions and help them get out. Another device that's used, actually an oscillating device that's used anyways, is the mechanical vest, also known as the high frequency chest wall oscillation. This works by loosening music by oscillating the chest via use of an inflating vest that has air pockets at them, and it measures the effectiveness by pressure and frequency, and sort of hopefully vibrates and helps you cough pretty much and get the mucus out of you that way. But all right, as far as devices go, I'm sick of them. I don't feel like talking them. Let's delve into techniques and say exercises. There are certain maneuvers that you can use to bring secretions up from the lower lobes, into the smaller airways, up into the larger airways, which is where we want them, and then hopefully out. Postural drainage and percussion is a technique that we actually saw the other day, and you can use it. A lot of it's based on gravity and the position of the patient, depending on where the focus of the mucus is in the patient. By use of mechanical assistance of the human hand, you can move secretions from the lower airways up into the upper airways, the larger airways. I'll show you an example, actually. There is the percussive, the chest physiotherapy percussive maneuver where you cup the hands and have the airway make it air pockets and go on the body. Pretend this is a body, okay? This is all I could come up with. All right. Now, by cupping the hand and having your wrist float back, kind of like not like a door hinge or something like that, but a really greasy one, because it moves really well. All right, so hopefully I'm doing this right, because I am not an RT yet. All right, anyways, you focus on the area that is has most of the mucus secretion in there, and then depending on what position the secretions are, where they need to be, remember the patient, I'll just consider this prone. And this, was it the lateral? Lateral something. Anyways, take this and move those secretions out using these air pockets, cupped hands. Hopefully this secretion's a little angled up, so gravity's helping get that the mucus from the lower airways out to the larger airways. All right. The next one is more of a vibration hands. When you cup your hands like this, kind of like a bird, and then you move, hopefully by vibrations, move the secretions also from the lower lobes to the upper airways, and hopefully helps you cough and get everything out. Now, okay. I got that part. For example, didn't show vibration techniques. All right, there is also something called airway clearance therapy. These are more controlled breathing exercises to help get rid of secretions. Again, focusing on getting things from the lower airway and out. All right, first I'm gonna give you the example of say the huff cough. First in, there's like, comes in like, you do it in like phases, I guess. You like breathe in slowly through your nose, hold for 3 seconds, and then followed by an exhale from the mouth. And then you follow this by taking a slow breath in and a long exhale. This should help move the like mucus up from like the lower airways into like, say, the larger airways. And then finally, you take a deep breath in, followed by like a short, forceful exhale. Like it moves the mucus out from like your lung into like your mouth and hopefully out. Like you go like a deep, followed by a short, forceful exhale. Cough right in here, and make sure when you're spitting it out, spit it into this. You don't want to see that. All right. Another one is called active cyclic breathing. It's like a 3-phase technique that helps get air underneath the mucus and then out. Now, phase 1 of this, you saw it's like a breathing control. You gently breathe in through your nose and relax the airways. Like zen. Then you do like a chest expansion exercise. You intake deeply, hold the breath in, hold for 3 seconds. This will move the mucus from the lower airways into the upper airways and get behind the mucus like we've been talking about before. And then after that, you do like a forced expiratory techniques. This is phase 3 is what they call it. And you huff cough. And again, like we learned before, the huff cough. Oh, cough into the shoulders, get it out. Hopefully all that stuff from the larger airways goes in again and out into napkin, say. All right, and the last one I'm going to talk about is called autogenic drainage. Autogenic drainage is also a 3-phase controlled breathing exercise. You take shallow breaths. Hopefully this will like unstick the mucus from the sides of like the small airways. And then you collect the music by holding in the breath for 3 seconds. Collect that mucus. And then you move the mucus out of the airways with a hard huff cough. Again, wipe up. Clean yourself up. Do not swallow that. Just get it out and get it away. All right, well, that's all I got for secretion clearance right now. Thank you for coming to my TED Talk. Zach was out, exit stage right.